I know we have several members of the media, so this is a on the record conversation with our panelists. So let's go ahead and get started. Um, Again, I'm Mike Quaranta with the Delaware State Chamber of Commerce. Thank you for joining our webinar this morning. Really important topic. This was a collaborative effort between the Federal Reserve Bank of Philadelphia, Rodel Foundation, the Delaware Department of Education, and of course, the Delaware State Chamber of Commerce. It's a very important topic. We know that we're experiencing in our economy nationwide a decades low number of participation in the workforce from women in particular. And this is clearly one of the determinants that is impacting their participation. So we're going to cover a lot of different ground. We know that employers of all sizes are on the hunt for talent. We need everybody. And as I said, childcare is an important factor for all employees. So it's interesting. What's the need out there? Study that we'll go through later this morning says we have an unmet need of about 71%. There's 71% of young children ages newborn to 5 have all available parents in the labor force, 71%. There's a worker shortage, 35,481 licensed capacity. That's the capacity if you took all the daycare facilities in the state of Delaware and you looked at what their capacity is. If every slot was filled, you could put 35,481 kids into those slots. We've got, however, between the ages of newborn to 5, 54,261 kids. So you can see that it's not a perfect disparity in terms of there's other factors that explain those numbers, but it gives you a sense directionally of the unmet need. We've got a lot of ground to cover. We've got some terrific panelists, so I'm going to turn this over now to Ashley Putnam. Ashley is the Director of Economic Growth and Mobility Project at the Federal Reserve Bank of Philadelphia. She has her undergrad degree from Barnard College and a master's from NYU. Ashley, thank you for joining us. Thank you for the research. We look forward to your presentation.
Thank you. And thank you so much, Mike, for your continued partnership and really, I think, an exceptional example that is being led here in the state of Delaware, where businesses, government, nonprofits, philanthropy are all coming together around this really critical issue for the moment in time we're in our economy. So before I get started, I do have to give my standard Fed disclaimer, which is that my views expressed here today are mine alone and do not necessarily reflect the view of the Federal Reserve Bank of Philadelphia or the Federal Reserve System. And with that, I'm really happy to tell you a little bit about why the Federal Reserve is in this conversation and why the Federal Reserve is talking about early care and the importance of childcare. So for many of you listening today, it isn't news to you that we are in a really critical moment for our economy. We are really sitting at the intersection of a lot of really challenging forces, and that is in part the COVID-19 recovery. Right, we're seeing businesses starting to reopen. They're looking for talent. They're looking for workers. We're also still dealing with the leftover business disruptions that have happened throughout the course of this past 2 years. And that is in large part a loss of talent, people who have been laid off, people who are not coming back into the labor market, which is resulting in this labor shortage that we're hearing a lot about on the news. And it's certainly something we hear about in all of the surveys and research we do here at the Federal Reserve Bank. This is also coupled with a great resignation, as they're calling it in the media, which is really the fact that a lot of workers are not returning to their former jobs or are leaving jobs, and the quit rate being much higher than we have seen in this country historically. And on top of this, what really brings us to this concern at the Philly Fed is that this is really exacerbating issues around increasing inequality, that we're seeing really disparate outputs and really disparate outcomes from this current recovery. And that in order for our economies to be resilient and for our regions to be able to grow, we need to be thinking about some of these critical issues to be able to have a more inclusive and more resilient labor market. So let's just narrow in on a couple of facts here. So moving forward on the next slide, what do we know about what's happening to our labor market right now? Well, the first thing you have all heard is what's happened in terms of labor force participation over the past 2 years. We know that nearly 2.3 million women left the workforce from the beginning of the pandemic. And for those of you who follow this statistic, you know that at one point in time, we reached levels that we have not reached since 1988 in terms of women's labor force participation. What that means is less people are in our economy, less people are going to work, and our economy is only as strong as the number of people who are participating. And that's a really concerning statistic when we look at our recovery. On top of that, we know that there's a major issue around childcare, and that's really what brings us to the conversation today. The cost of childcare has been increasing. This statistic has always floored me that 20% of the median household income is spent on just one child attending childcare. So you can imagine for families who are weighing the decision between returning to the labor market and the increasing cost of childcare, there are many families that are saying it's actually less expensive for me to not return to the labor market and to stay home and take care of my child. And then finally, this is really resulting in some really critical issues for businesses. We hear this a lot in our research on small businesses and the surveys that we do, but small businesses in general are struggling to find workers in recovery. And I think what you'll hear today is that those small businesses also include childcare providers who are struggling to find talent and struggling to figure out how they're going to make it through this moment. So this is the problem, and this is the problem that brings us all here today. I think the question we're here to ask and maybe discuss and answer is, what are we going to do about this? How do we start to think collectively to solve this problem? So that's the work I'm excited to lead. Next slide. This was mentioned by Mike today, but I lead a strategic initiative that the Philly Fed launched about 4 years ago. That's called the Economic Growth and Mobility Project. And it really is focused on exactly what we're here to do today. Thinking collaboratively, thinking across partners about how we can elevate solutions, how we can innovate, and how we can work together to address some of these really systemic issues that, to be fair, existed long before the pandemic, but have been exacerbated by this crisis. Next slide. And so the way we do this at the Philly Fed is what we call a research in action lab. And it's really bringing together the two strengths that we have at the Federal Reserve. The first, of course, is research, which I'm going to talk a little bit about today, some of the research we've conducted as a part of this engagement. And the second is the work we get to do with partners like all of you in this room. And so that is the work we get to do with the Delaware State Chamber, with Rodel, with the Delaware Department of Education, to really find that intersection. So we're not just talking about problems, but we're talking about solutions. We're talking about how these can be community-driven, innovative, and actionable approaches to actually address some of these problems. Next slide. So just to understand what a research and action lab is and where we are, a research and action lab is a process, not a product. So it's not one event, it's not one research paper, it's really an engagement that exists for a period of time. And this is very exciting to me today because the work we've been doing with everybody who is here has been going on since 2020. And so this really started with this partnership between the Delaware State Chamber of Commerce, Rodel, and the Delaware Department of Education. Those folks coming together to say, this is a critical issue. What are the things we can do collectively to solve that? How can we elevate solutions we know exist? How can we connect businesses in innovative ways to work that is happening in ways they can also be advocates for investments in early care? So one of the ways we've informed that is through some localized research. So we do have a tool that has come out with some great analysis. If you want to go look at the map of Delaware and see what it looks like across, different parts of the state. We also have some market analysis that's been conducted. And then most importantly today, the research we're going to discuss about what we learned from interviews with small businesses and providers in terms of what the trends are in childcare. Next slide. So the first thing to know is that this is not a new topic for the Federal Reserve. We didn't just get into this when we started talking with folks in Delaware. We do know that early care is vital to a strong and regional economy, and that research shows that investing in early childhood education can lead to really incredible returns on investment. We also know that a 2-generational workforce strategy allows parents to participate in the economy while preparing for the future of work. And so this is actually really good both for workers in the future as well as for the current workforce. Next slide. So this is some of the things that we heard from our research, and these are some of the statistics I want you to walk away from. Mike mentioned this, but I think what we really need to talk about here is that the demand for childcare, no matter how you cut it, is much greater than the supply. Majority of providers aren't able to operate at their licensed capacity. So we mentioned this match between licensed capacity and the number of children that are in need of childcare, and understanding that that is an underestimate of the supply-demand mismatch, right? Because those providers aren't able to operate at licensed capacity and the staff-to-child ratio requirements with staffing shortages, Even if you're licensed at a certain rate, you actually can't even provide those number of seats at childcare. So for those of you who are in this space and have been talking about this for a while, you understand that this real shortage of childcare slots is deeply impacting the workforce and people's ability to return to work. It's also impacting things like the cost, the demand for workers, and whether or not people are able to actually go back and be in business. There's a larger concern as well around ECE professionals, right? We're seeing the supply side shortage that 96% of Delaware childcare centers are experiencing a staffing shortage, right? So I mentioned that labor shortage. We don't think about that labor shortage as it impacts early childhood providers, but that is a really, really critical issue. Now, we also need to talk about the demand side of this equation, right? So we have the supply side statistics here, which are represented in the toolkit, and I hope you'll take some time and read some more. Let's go to the next slide, and we'll talk a little bit about what we hear on the demand side, which is what's happening in terms of working parents in the business community. So 71% of young children in Delaware have all available parents in the labor force, right? So parents are working, and parents are in need of childcare, right? And 24% of Delaware's workforce has school-age children. So this is just a really critical issue for the state of Delaware in terms of being able to rebuild the economy. And we know that those workers with children make up a large percentage of the total workforce. And again, these families are spending 20% of the median household income on childcare, right? So I mentioned this as a critical statistic because it does really help us understand why families are really struggling to go back to work. And I think this last statistic here is one I want to mention here, which is that families were leaving Delaware at a higher rate than the national average. And so we're not just talking about something that is good for working families or good for childcare providers or good for small businesses. The issue we're discussing today is about the regional economy, how to make it more resilient, how to make it more inclusive, and how to be sure everybody has the opportunity to participate in the labor force. And so before we turn it over to the panel, I want to conclude with one thing on the next slide here. I mentioned that these research and action labs focus on research and how to bring research to bear on these critical economic issues. We obviously have this great partnership, which to me is just an incredible first step, that the business community is coming into this conversation in new and innovative ways. And I hope for all of you listening today, you will think about the role you can play. This isn't just for everybody who's involved in this research and action lab. This is for all of you listening. So if you are a business person or a member of the Rotary Club or a member of the United Way, anybody listening in, I want you to reference this toolkit, to listen to what the panel has to say, and to think about how you can get involved and engage, because this really is a critical issue for the economy in Delaware. And that's where we're going next. We want to talk about cross-sector solutions. We know this is not just a problem for business, and it's not just a problem for government. In order for us to really get at the systemic issue here of providing better quality, affordable early care opportunities for families, we need to be working together. And so that's what I'd like to encourage you to do today, is think about how we can work together to advance these issues. With that, I am very excited to turn it over to this fantastic panel we have coming up. And I believe I'm turning it over to Madeline. Is that correct?
Yeah, thanks, Ashley. And thanks to the Fed for the decades of research you all have done showing that this is one of the best investments state government, federal government can make in young children for the return. So, and thanks, Mike, for hosting this. I think you guys did a great job painting the picture of kind of workforce of today, workforce of tomorrow, and what does Delaware have to focus on here. I'm Madeline Byard. I'm the chair of the State Early Childhood Council, and many of folks today are familiar with that group or are on that group. So thank you for being here. And then I also work at Rodel, which is a policy advocacy organization on public education in Delaware. And just want to make one statement that may be obvious, but I think is worth making, that, we as a society have decided that public education starts when a child turns 5, and we make it available to all children. For children birth to 5, despite that being the biggest area of brain development and the biggest return on investment that the public can make, we are only investing in about 20% of young children, and we're investing in them at a rate that doesn't even allow childcare providers to meet the current state requirements. A recent study we did about the true cost of childcare shows that providers can't really even make ends meet with the rate pays for that limited amount that they pay. So we have a long way to go, but we're excited about the collaboration and the partners that are here with us today to have this conversation about how do we solve these problems and how do we work together across sectors. I'm really excited to introduce some panelists. I'm just going to kind of give name and organization and then ask them really to kind of explain where their organization is located and paint the picture of how this crisis is impacting them. So would invite panelists to come on camera. We are welcoming today Karen Hartz, the Director of Early Childhood Services at the Latin American Community Center, Benjamin Gray, the General Manager of Belmore Inn and Spa in Rehoboth, and Caitlin Gleason from the Associate Secretary of Early Childhood Support at the Department of Education. So I'll ask each of them just to say a little bit more about their organization and how this plays out day to day for them and the folks that they serve. Karen, you want to start?
Good morning, everybody. As Madeline said, my name is Karen Hartz. I'm the Director of Early Childhood Services for the Latin American Community Center. And we serve about 120 families who use our childcare and other state-funded early education programs in Newcastle County. So like many employers right now, we're finding it difficult to hire staff in order to expand to serve more families. However, unlike most other employers, this is the challenge that we've been facing for years and years. It's just become more pronounced with the pandemic. So what's also become more pronounced with the pandemic is the amount of families that we have on our wait list who have not been able to find childcare. So as of today, we have 117 children on our waiting list, and we've not been able to serve them because we don't have space. We are in the process of constructing a new building that will allow us to serve about 100 additional children. But we're really unsure of our ability to hire all the staff that we will need in order to staff those classrooms and be able to accept children into those classrooms. So I'm happy to see that we have participants from outside the field of early education who are willing to work on solving this childcare crisis that we're facing.
Ben?
Hey, good morning, everybody. My name is Ben Gray. I'm the Area General Manager for EOS Hospitality. I represent the Belmore Inn and Spa in downtown Rehoboth Beach, and also Bethany Beach Ocean Suites and Hotel Bethany Beach. So a total of 3 properties and 180 employees that I work directly with on a daily basis. And I can tell you that this is absolutely the #1 challenge that we face every single day for our hotels. And again, 180 employees, roughly 10 to 20% of those do not show up for work every single day because of lack of childcare. I'll give you one example of a supervisor that I just hired, and we offered some relocation assistance to her to move her and her family to Delaware to work with us and in our hotels. And she was really excited about coming to the Delaware beaches and working for our hotels. She brought her entire family over here, bought a house, ready to go. And she said her first day of work, she came in and she said, "Can I have a list of childcare places for my kids?" And I gave her the same list that I gave everybody, and including places where my kids go to daycare. And she went to all of those places and she said, "You know what, Ben, I came back and they said, okay, great, let's take down all of your information. We'll put you on the waiting list." And she said, "Okay, do you think I can come in, within the next, 2 months, like June or July? When can I start enrolling?" And they said, "Oh no, we can't enroll your kids until 2024. And she looked at me and she said, "Ben, what am I supposed to do for the next 2 years?" I said, I uprooted my family and I moved to Delaware, and I don't have a place for my kids to go. And so it wasn't even something that I thought of in moving somebody here with the lack of childcare that we have. Not only that, but my staff on a daily basis continues to call out because of a lack of childcare, childcare centers that are closing, that have just been exasperated by the pandemic. And one of the most recent questions that I received in an interview process when interviewing for new candidates was not, do you offer 401k, paid time off, what is the salary requirements? All those things are so important. But one of the top interview questions that I now receive from candidates is, do you provide childcare? Which in my entire 10-year career in hospitality, I've never had that question asked of me. So it is absolutely a systemic issue, and I'm happy to be a part of the conversation today.
Caitlin.
Good morning, everyone. My name is Caitlin Gleason. I'm the Associate Secretary for Early Childhood Support in the Department of Education here in Delaware. And the Early Childhood Support team is actually 2 teams made up of the Office of Early Learning, who's thinking about quality initiatives and how to recruit and retain professionals in our state, and the Office of Child Care Licensing, which is responsible for creating regulations for the health and safety of our children in child care facilities. So they focus primarily on space and monitoring that. And so as Ben and Karen pointed out, we also are grappling with the policies that will incentivize more professionals into the field. We recognize that our wage is very low in our field, and how can we support qualified professionals in obtaining a livable wage while also providing quality care for our children in spaces that might have more flexible hours, might be more geographically diverse, so that we can serve all families in the state. We think about how we can be more innovative around childcare facilities being close to home and close to work. And so I just want to echo that Karen and Ben bring up points that we need to rethink with our policies, because we want to incentivize the conditions that allow for more people in the field to be serving children and families. So I appreciate the opportunity to have this discussion today.
Thank you all. Karen, maybe we can focus on those families, that you're serving and that you have on your wait list, and kind of paint the picture as families try to work through the process of eligibility for public assistance. And then also, like, what are you telling them their options are? Are there places to go in New Castle County, or is it similar to what Ben's saying, that no matter who you call, it's going to kind of be the same answer?
Right, so families who want to receive assistance for childcare in Delaware, it's called purchase of care. They have to apply through the state the same way they apply for Medicaid or for SNAP. And they're determined eligible if their family income is 185% or below of the federal poverty level. What we've been seeing recently is that families who may have qualified in the past are no longer qualifying because wages in Delaware have been going up with the minimum wage increase and with just having to keep up wages to compete in this labor market. And so we have some families who don't qualify, and they say, okay, well, I guess I just won't be able to go to work. I'm going to have to stay home because they can't afford to pay the private rates for tuition in order to go back to work. And that's usually a situation where one parent is working, one parent, the mom usually, is at home. She's trying to go back to work. She applies for purchase of care and finds that, nope, they're not going to qualify, so she can't go back to work. When families do qualify and they have their purchase of care, that doesn't necessarily mean that they're going to get a space, because we don't have any spaces, and most other child care centers in New Castle County do not have spaces available for families to take. And so just the fact that I have purchase of care doesn't mean that I can get child care. We really don't know where to send families to get a space when they call us.
And Ben, would you add anything in terms of what you're seeing, families, either your peers in hospitality, how are they handling this? And, hospitality being one of those industries where you can't just sort of work from home whenever from a computer. How are you handling this, knowing that you have, specific shifts, and what are you seeing in your industry?
Yeah, you're exactly right, Madeline. You can't clean a room from home, right? So I need my housekeepers to be there on a daily basis. You can't check somebody in remotely in your hotel. You need them actually physically present on property. And one of the number one questions that I get, as people start coming and wanting to come to work so that they can provide for their families is, okay, Ben, I can come to work tomorrow, but can I bring my 5 kids? And the answer is, I'm sorry, so the only other option that they have is that they have to stay home, to Karen's point. And that's really tough for us, especially in the hospitality industry. I mean, I've had colleagues that have had to shut down inventory in their hotels because they didn't have enough housekeepers to clean the rooms because of the lack of childcare on a certain day. I mean, you'll see me driving the Belmore shuttle to and from the beach every once in a while because I don't have a shuttle driver because they're home with their kids. One of the most recent examples that we've had that's absolutely affected all 3 of our hotels is that a lot of the childcare facilities, because of the lack of staff, have went from closing at 6:30 at night to 5:30 at night. And that 1 hour, especially for those employees that are working later shifts in the hospitality industry, is huge for them. And so I had one colleague share with me recently that she actually went out and purchased a new car seat and gave it to a friend of hers just because they knew that they might be available or in the area to pick up their kids. And they added that friend to the emergency contact list of the childcare facility so that if they can't leave work on time, to get their kids, because of that 1 hour difference, they at least have an emergency backup friend that has an extra car seat that they had to buy just to pick up their kids on time. And these stories, I got tons of them, right? But this is the most recent example of to Karen's point, what's going on and how it's affecting the workplace right now.
Yeah, Ben, I actually am that friend for a couple of people. And so another thing another thing I want to echo, though, Karen made this point too, is that we also see childcare is closing their rooms because of a lack of qualified staff in the field itself. And so, you know, we do also have to think about this in two ways. One, childcare being a support for our all of our employers statewide, but also childcare as a business market itself, and having the professionals to meet demand for families.
Yeah, with that, Caitlin, do you want to comment on some of the things that are underway in terms of at the state level to support the workforce and the providers in the mixed market of childcare?
Yeah, so I'm excited about conversations that have been happening around expanded state funding for preschool. We are the Early Childhood Assistance Program, the ECAP program is the state's preschool program, supplemented by the Reading Full Day Preschool Program in Wilmington. And we're hopeful that more state funding will serve 3- and 4-year-olds. Opportunity funds are coming next year to expand that pot. But that is direct money to seats for children, and it doesn't completely support the workforce. So we're also thinking about systems of support for the workforce, cohort models for higher learning opportunities, you know, how we get more professionals qualified and excited about the work. So we are thinking through cohorts and scholarships. We just started a partnership with Delaware State University, who will be rethinking the way that we offer the credential for early childhood professionals in the state. So we are definitely looking at some of the more innovative recruitment tactics. But as I mentioned, the retention is always a challenge because of the amount of funding we have to pay the workforce more. And that's a conversation around purchase of care, as Karen just stated, and in general, our wage scale for our field. And so we do continue to see barriers and challenges around funding for the workforce.
Karen, do you want to comment on what you think would make the biggest difference in terms of kind of what the state can do to support childcare?
Well, we have a system that could function on a much higher level. That's the purchase of care system, right? So we already have a system in place where families can apply to get subsidized childcare. The problem is that, you know, at the point where families are cut off isn't necessarily the point where families can afford to pay the full rate of childcare tuition. And so in order to really fix the system, we need to do two things. One is increase the number of families who are eligible to get that support. And the second is to increase the rate that the state is paying so that it actually can pay a living wage to staff who are staffing those childcare centers in order to recruit staff into the field, right? No one wants to go into a career where they're going to be making, you know, $10 an hour with an associate or bachelor's degree for the rest of their life. And so we really need to create incentives for young people to go into the field of early childhood education so that we don't continue to have the staffing crisis.
Right, and just, I see a question, popping up in the chat about, do most providers offer purchase of care? And one of you may know the percentage that do, and some offer 1 or 2 slots, some are closer to 100% purchase of care, but I think we know for sure that most providers would be willing to accept more state-funded children if the rate were higher. I don't know if either of you want to comment on that. Specifically, providers either no longer accepting purchase of care. I saw one statistic recently that 1,000 fewer infants are being served in Delaware over the last few years, likely because providers are no longer accepting infants because they can't make ends meet with the low state rate. So I don't know if Caitlin or Karen you would add to that.
One thing I'll also add about the infant care piece is the ratio that it's much harder to care for, 12 infants in a room, right? Our ratios are much lower than that. It's less profitable for a business to have an infant room because they need to pay a professional with a low number of infants versus opening a pre-K4 room where they have a higher ratio of adult to children. And so when you're thinking about families paying per child, The age of the child and the ratio makes a huge difference in how these businesses are thinking about their bottom line. And so that's another thing to highlight too around accepting purchase of care, right? This is a market-driven subsidy. And so we need to be aware of the policy implications of this being a market versus a public good.
Caitlin,
Karen,
I think that's an excellent point. I mean, not only as an employer, but also as a dad, right? I have a 4-year-old, I have a 2-year-old. I can't tell you the ratio question and the ratio topic that gets brought up every day when I get them to school or to daycare. They are consistently reassigned because of that ratio problem. And so that definitely speaks to the volume, and that it absolutely is a systemic issue, because the one room that I go in for my 4-year-old on Monday is not the same room that he goes into on Tuesday. And it's crazy how that changes so rapidly. And it absolutely has been an issue for us, and not only as an employer, but also as a father.
Yeah, and I'm not sure the percentage of purchase of care in general that childcare centers in Delaware accept. I think it varies greatly based on geography. And we need to also think about this in terms of equity. Centers who are located in low-income areas and that serve low-income families, aren't able to just say, well, we're going to limit the amount of families we serve who use purchase of care to 20%, right? Because the market that they're in, everyone who lives in that area qualifies for purchase of care. And so we also have to think about, when we're telling childcare centers that they need to balance their private pay clients with purchase of care because purchase of care pays less, that we're creating a system that is not equitable across the state.
Yeah, just a statistic on that. Currently, the state pays childcare rates based on a market. So that's basically what can the state afford to pay and what can parents afford to pay. And we know neither can really afford to pay the full amount at the rate we're investing now. Kent and Sussex County are getting about 40% less per child. So we see much more significant childcare deserts in Kent and Sussex County because of that. So that's one of the many systemic issues that needs to be fixed. And I see a comment about the long-term care economy and about grandparents taking care of children. I mean, it just shows the extent of the sort of village and flexibility within business, within families that this has taken, and how disruptive it's been to multiple generations. So, well, let's step back for a minute and say, what can business do? We really appreciate the Fed and the Chamber hosting this and bringing voices like Ben's to the table. So, maybe a comment from each of you about, if you when you have the business audience in front of you, what do you think some of the most impactful things, 1 or 2 impactful things you think business leaders in Delaware could do to help impact this? Karen, do you want to start?
For me, I think the most important thing is speaking up with policymakers, whether that's, legislators, members of the executive office. I feel like the field of early childhood education has been speaking up on this for many years. But if we're the only ones who are doing this speaking, we don't get a lot of traction. And so when the problem becomes everyone's problem and not just our problem because we can't find staff to staff childcare centers, that gives it a lot more importance. So, that would be my suggestion, is to really get out there and talk to whoever your representatives are.
Ben, do you want to add?
Sure. So for me, I mean, as a business leader in my community, I mean, I absolutely agree with Karen. I'm also chairman of the Delaware Hotel and Lodging Association. It's something that we're actively advocating for all hospitality businesses in the entire state of Delaware. And it is very, very impactful, is that this is a universal problem and it affects all Delawareans, right? Every single resident in the state is affected by this, whether you're covering a shift for someone who is a parent or whether you're a parent yourself and you can't show up for work. This affects all Delawareans and it is a universal problem. For me, I think statewide, I really try to focus on acronyms as much as I can in my profession in trying to teach people the generation of hospitality. And for me, in this particular instance, it's all about the AAA mentality. For me, that childcare has to be, first of all, accessible for all Delawareans, for our entire workforce, that it has to be accessible and that they have to be able to get there. I have some employees that right now are driving an hour and a half just to drop their kids off to a childcare because it's the only one in our area that had availability. And I wouldn't even consider that in our area for driving 90 minutes to drop your child off and then going to work after that. The second thing that it has to be is available. So not only does it have to be accessible, but it also has to be available and open and accepting so that you're not on a wait list with 300 families and you can't get in for the next 2 years. It has to be available. And then finally, and probably most importantly, as we've discussed today, it has to be affordable. And it has to be affordable for the Delawarean. It has to be affordable for the employee, because if they can't come to work to get the paycheck to pay for their childcare, then it's going to cause a ripple effect for their entire family. And they're not going to be able to provide for their family if they can't get to work to pay for the food that's on their table because their kids are at home with them instead of in the daycare that they can't afford in the first place. So accessible, affordable, available. It all has the ripple effect. And if we're able to solve those three things one by one and continue to advocate at the state level, to Karen's point, I think we're going to make a huge impact on this issue.
Thank you. Caitlin, what would you add?
I really want to harp on the affordable A that Ben suggested. I think that when you talk to legislators, as Karen suggested, and think more about the funding, Dorothy added in the chat, moving from market-driven to policy-driven. By focusing on that affordability, you can then be innovative at the state level, right? I can partner to create better policies that allow for more accessibility and availability, right? We can be more creative around the types of spaces that our facilities can start, like childcare facilities can start different types of facilities. And I think that starting there and actually creating a plan and then funding the plan versus creating plans for funds could drive this change at the state level. I'll add, so I'm also looking at the chat here, and I wanted to respond to the pandemic funding, and it did not translate necessarily into more facilities. It was meant to keep doors open because pandemic regulations required higher health and safety costs, right? We needed more materials, and also it lowered the ratios. So because of social distancing and whether programs were able to open their doors in case they had a COVID case, that impacted, how long they were able to be open, and also they had to take less kids, so they were under enrolled because of the ratio requirements. So our funding that we did supply to childcare programs during the pandemic was really meant to just keep them afloat.
And I would just add that the pandemic probably just exacerbated a crisis that existed before the pandemic of no one coming into the field, people not staying in the field. And we hear frequently of, nobody even applying anymore. There used to be people applying, and maybe by the time they had their first day, they had gotten a better job at Costco. But by now, nobody's even applying for the job. So certainly we're not seeing an expansion of supply, which is something we're going to need to incentivize as a state. Linda, great point. Businesses are running their business. I think that's why it's great when we have folks like Ben who are willing to speak up, but also people like you that represent economic development. I see, Shelley and Lauren and other, Mike's here, really strong voices for business. And those are part of our coalition. And, we hope to be able to help navigate the system to make it easy for them to speak up. If you want to write an opinion, if you want to call your policymaker, if you want to testify at Joint Finance Committee, there are lots of different ways to get involved, either as an individual, as a constituent, as a citizen, as your business, or as part of an organization. So if there are ways that the groups on this call, can make that easier for business voices to get involved, certainly would welcome suggestions there.
I just wanted to add that, I understand the feeling of I don't have time for advocacy, like I have to run a business. We feel the same way in childcare, right? We have childcare centers to run and we're all short-staffed. And so we're playing multiple roles that haven't been able to be filled. But, eventually I just came to the realization that if I'm not working on solving the large problem at hand, I'm just spinning my wheels. Because we're going to continue to have these shortages. We'll always be in crisis mode. And so, eventually as a business, it may get to that point for businesses as well, that if the business can't solve the childcare issue for its employees, that they're also just spinning their wheels. And so sometimes it's just we have to change our perspective of what is the most important thing for me to spend my time on in order to further my business.
And I would add that the report that today's conversation is based on, which maybe Kelly can put in the chat if folks haven't seen, really, is a toolkit about how business can get involved and what has happened elsewhere. Oh, Kelly's already on it. Thank you. So I'll just mention a couple things there. On-site childcare comes up, people are asking that of Ben, can you provide me the childcare? We've seen those come and go. I live in the city of Wilmington, and my kids were in the centers that closed or were owned by different companies. And so the other thing is they're going to have to hire from the same workforce that Karen's trying to hire from. So just building more facilities is not going to solve the underlying problem of the amount that we're investing in childcare. So I think we need to think broader, more creatively. Mike's had some suggestions about some tax credits or some incentives. If you do offer childcare on site, could you get some kind of tax benefit for opening up slots to subsidized families as well? There have been some conversations in other states and some interest in Delaware around tax credits for the workers in childcare themselves. So right now there's no state salary schedule like there is in K-12, where if you work more years and if you get another degree or more credits, you can earn a higher wage. But in childcare, if you move up sort of the credential and then AA, BA in other states, workers are getting something like an 8, 10, 12% refundable tax credit. And that has been a way for the state to invest in those folks. There's also a bill right now that's been introduced in the Delaware House of Representatives. So when you call them to tell them to increase purchase of care in the state budget, please also tell them to vote for House Bill 377. This is really a partnership with Caitlin and her team to codify some systems of support for the workforce. So she mentioned, incentives, scholarships, the support systems for folks who are working a full day and then are trying to figure out how to get those credentials so that they can get on a career path. So we as a state need to do what we can to support that workforce as well. So there are a number of other things in the toolkit, but yes, there's lots of ways to get involved. Would anybody want to add to that? Any of our panelists?
I just want to highlight what we've been all saying. I think underlying all these messages is this is a very complicated problem, and it's going to take a lot of different types of solutions. And so for us to continue to think through whether we are a childcare market, that these are businesses versus a public good, will also impact the funding policies that we put in place. As Madeline mentioned about the salary scale, that is for our public education teachers, and our childcare educators are not considered public school teachers.
I see a question in the chat about which is more important, increasing the number of families who are eligible for purchase of care or increasing the reimbursement rate. I can't say that morally one is more important than the other, but what I can say is that if we don't increase the reimbursement rate first, it won't matter if more families are eligible because there will not be slots for those families to use, right? So in order to create more space that children can fill, we first need to fix the reimbursement rate so that those spaces can be opened.
And I would add that that's an and answer. We have to do all of it. I mean, Caitlin mentioned that pre-K is becoming increased. If we only increase pre-K, we could potentially have unintended consequences and have even fewer slots for those infants, 1-year-old, 2-year-old. So we need to do it all. And the reality is most other developed countries have done this. They invest something like 5 times the amount that Delaware and the US is investing in toddlers. So really moving toward the notion of a public good where, one of the quotes that stood out from our advocacy day is that a child's outcome doesn't depend on their parents' income or their ability to navigate the burdensome process that our state has established over the years for them to qualify, as Karen has mentioned. So we need to do all of it over a long term, like Karen is saying, and think of other creative solutions. So benefits have come up, shared services have come up. That's been something that's been looked into. Thank you, Jamie, for raising it. And just to put a pin in what Dorothy's raising, this year's focus for those of us on the Advocacy Coalition is about increasing that purchase of care rate. so that we get 40 million more in the budget to sort of stabilize those rates, to be able to keep centers open, keep up with minimum wage, to be able to fund Kent and Sussex at a fair, equitable rate, just to be able to kind of keep the system we have now working and serve the families that are eligible, while we also increase eligibility over time. And we can put in the chat the talking points and the way to contact your legislator about that. Caitlin, it looked like you were going to add something. No, okay.
Covered it.
Any other questions, folks, see? Or anything else you want to cover? I think I would want to give each of our panelists kind of an opportunity to have a closing comment, either something you didn't get to say, or, advice for everybody on the call. You have a wide, variety of folks on the call, not just business. You have some community organizations, advocates. So, either something that you want to make sure that we say, and or advice for folks on the call. What can we all do to support this issue? Karen, do you want to start?
I guess my advice would be the same, to just really reach out to your legislators, especially since right now they're in the process of approving the budget that's going to determine what will the purchase of care funding be for the next fiscal year. And writing an email only takes a few minutes, but it can be impactful.
Ben?
Yeah, for the employers on the call, and for those that can actually take this piece of advice and pass it on to other employers, I can just say, as someone that represents over 180 employees in this county, is just be patient, be compassionate to your employees, recognize and realize, and I hope that the things that were said on this call at least makes you realize that for those employees that are unable to make it to work, it's not their fault. Right. This is, as we explained many times, a systemic issue for the state of Delaware. However, I'm not necessarily someone, and neither is anyone on this call, that is problem focused. We're all solutions driven. And I would ask that everyone on this call, as we continue to dialogue about this issue and how we can focus on the solutions, is that we not focus on the problem, but we redirect our focus on the solutions that we discussed today, and the solutions that they're actually in the toolkit that we're going to be providing you today. But from an employer standpoint, I just ask that you please be patient. I can't tell you how much your employees will understand and appreciate that, especially in the employment crisis that we're in right now. If you have a patient employer, knowing that they're going through this issue that they cannot control, it'll make the absolute difference in making them want to work for you on Wednesday when they can't make it to work on Tuesday. And that's the one piece of advice, minus the advocacy, that I can offer you to continue to work on a day-to-day.
Caitlin?
Thank you. So I have less advice, but more just gratitude for the fact that we are all thinking about this together. As I said, this is a complicated problem that requires truly a different approach to policy. We need to change the conditions of the way that we approach this field in our state, childcare in general, and this conversation is starting that. I also just want to express gratitude for all of the childcare programs that are out there that are open. A lot of times when we talk a lot about the problem, we also don't acknowledge the good that's happening. And so I just appreciate the folks who are in the field who are able to keep their doors open so that we can have our economy function, since they are essential workers, as we've very much learned during the pandemic. So I appreciate employers who are being flexible in their scheduling to keep their workforce intact, and to be compassionate to the early childhood workforce themselves, and then also to the professionals who are keeping their doors open for children. So thank you to everyone.
Well, I just want to say thank you to our panelists. We are so fortunate to have Caitlin, new leader at the state level with lots of experience and a long-term vision. I think there's a lot of systemic work that we've had our eye on for a long time. And so I'm optimistic that her leadership will help us move that forward. Karen has been an incredible advocate for families as well as childcare workers in the field, and just speaks to this so directly and eloquently. And thank you. And Ben, thank you for representing employers and speaking, to others in your industry. We can't thank you enough, and we need more of you. So let's all go find more voices like Ben in our community. With that, I think I'll turn it back over to Mike. Thanks, Mike, so much for hosting this today.
Sure thing. And while I have all of you there, I do want to raise two topics, if I could, Madeline. I think and some of this has been touched upon, but I want to go back to a point that Linda Parkowski made. And I want to explore this a little bit more. And Karen, I might want to call on you first. I'll put you on the spot. Madeline referenced that she had personal experience with employers using available space for on-site care. Not a perfect solution for sure, but many employers have an abundance of space, especially those in the services industry. City of Wilmington, prior to the pandemic, had over 1 million square feet of available office space, and post-pandemic, with people working remotely, there's actually, that number is bigger now. Now, if you're, I'm going to pick one, let's say you're a bank, don't want to be in the childcare business. It's not what you do. But if I had a floor that was available and I could outfit it correctly for a provider, charge you $1 a year for rent, is the savings in overhead substantial enough to help you then pay more wages, attract more kids, and have a successful business? Do you think that model, do you think the economics of that could work?
Well, costs for childcare centers are generally 70 to 75% of the costs are staffing, right? And so if we're not paying occupancy costs, that may save us 15 to 20%, right, of our annual budget each year. And so that is a significant amount. That's something that could possibly, work, provided that we can do some other things, I think, in addition to that, to address the staffing crisis, because, we would still need to be able to find the staff to staff those classrooms that we would want to set up in order to care for employers' children or employees' children.
Right. Thank you for that. And then, and some of you talked about this, and I think it's something that we're going to look at more carefully. And I think, I know we'll engage larger, the business community around the state and different organizations that people belong to. And that is the whole conversation about the benefits cliff. I have no personal experience with this, but for the members of the community who do rely on social services and public benefits in order to get through life, it's a very real issue. We have employers who know, and they've come to us and talked about this, employees who have refused job promotions with higher wages because that the benefits that they receive, they'll no longer be eligible for. Whether that is big impacts on their housing, where they live, transportation patterns to and from work, family and friends that they rely upon for things like care, like the one topic we've been talking about this morning, schools that their kids attend, etc. So I think we have to come back to that topic and think through what those cutoffs are, because it's having an impact. I know that, I think it was Caitlin, you might have referenced, yes, it was, the raise in the minimum wage. An unintended consequence was it pushed people out of eligibility for certain things. But there are people who are being offered promotions with different Delaware employers, and they're not accepting those because this is incredibly disruptful for the rest of their life. So the question I wonder is, how can those things be more graduated, as opposed to what the word suggests, cliff-like in the delivery of services. I don't know if any of you want to comment on any of that, but I do think that's a piece of work that everybody's got to wrap their head around.
Yeah, Mike, I'll just share that a sliding scale fee is an interesting concept that actually Build Back Better legislation, when it was being thought about, had suggested for infant through 3-year-olds. And so we recognize this as, one of those policy conditions, like I mentioned, that are truly impacting the day-to-day of families. And it's not just in childcare, right? That benefits cliff has implications for food, housing security. And so we do recognize this as part of a dual generational approach to helping families in the state. That's something the governor's very interested in. And so we have to think about it. That's on the list.
Mike, it's huge. I mean, I had an associate last week that declined a raise but accepted a promotion because it would push them out of that cap, right? It happens nearly every day in our industry, and it just shocked me. So it's great that you brought that up. It happens regularly, and I couldn't believe that they came to me and they said, actually, Ben, I'll take the promotion. Thank you for the new title, but can you actually keep my salary the same? Because it'll benefit my family more.
Yeah, you know, there's a psychology to, and I don't, again, I have no personal experience with this, but I would assume that there's a psychology to, you know, that stability, I guess stability is the right word, the regularity, the rhythm that one gets into. And there's some people who are going to be willing to take that step, take that promotion, take that, you know, additional income. And there are others who will be very fearful because maybe they've attempted that in the past and maybe for whatever reason it didn't work. I don't know, but I think there's something there we have to unpack as the business community, public policy leaders, and the implications this has for employers of every size and in every industry around our state. Well, let me thank all of you very much. We've got a couple of upcoming events that I want to talk about before we drop off, but again, thanks to everybody, Federal Reserve Bank of Philadelphia, our panelists today, Rodell, the Department of Education here in the state, for their partnership with all of this work. We greatly appreciate their work and attentiveness to this issue. Finally, so the upcoming events. We've got our Superstars in Education and Training Awards ceremony coming up on May 9th. We're very excited about that. We're going to recognize some winners from high school programs and independent training providers and college and university programs. Excited about that. We have a networking breakfast on the 11th at Stat International, and then a workplace wellness webinar. Try to say that fast 3 times. Workplace wellness webinar on Tuesday, May 17th. We're excited about that too. It would be an event just like this one. Different subject. You can find all that information on our website, dscc.com. Again, thanks to everybody for their participation this morning. Thanks to all of for all of you that joined us and shared part of your morning with us. I'm Mike Quaranta from the State Chamber. Thanks very much and have a great day.